Hey guys, welcome back. Today we are going to discuss about urinary tract infections, nursing diagnosis and care plan. Let's see what is urinary tract infection first. So what is urinary tract infection? Urinary tract infection or UTI happen when bacteria enters and infect the parts of the urinary system such as urethra, bladder or kidney. The most common cause of UTI is a type of bacteria called Escherichia coli or E. coli. UTIs are one of the most frequent infections occurred in hospitals, and when they are caused by the use of urinary catheter, they are known as catheter associated urinary tract infection. And outside of the hospitals, UTIs are especially common in women and older adults. And it is important to detect and treat UTI early as much as early to avoid serious complications and kidney infections. Although urinary tract infections are usually easy to treat, if left untreated or missed, they can lead to serious complications like sepsis and which can be definitely life-threatening. And nurses playing a key role in identifying patients at risk of urinary tract infection and educating them on how to prevent these infections. The most common symptoms of urinary tract infections are frequent urge to urinate, pain or a kind of burning sensation during urination. And other possible symptoms are cloudy or foul smelling urine, blood in the urine, pain in the lower back, sides, and lower abdomen. Incontinence, that means leaking urine. After passing urine, also you will feel leaking of urine always. Then abdominal cramps, fever, chills, fatigue, and without any clear cause, you will get fatigue. Then high white blood cell count, and in the blood test, clearly it is visible. Then confusion or changes in the thinking, especially in older adults. So these are all the most common signs of UTI. The major signs are frequent urge to urinate, like always you will feel to go to toilet. Then pain or burning sensation during urination. And while coming to the risk factors are female gender, especially with shorter urethra, indwelling urinary catheters, anatomical urinary tract abnormalities, history of UTI, immunocompromised status, vesicourethral reflux, enlarged prostate, diabetes mellitus, pregnancy, changes in the pH or vaginal flora, poor perineal hygiene, and use of vaginal douches, sprays, and powders. So these are all the risk factors. And if we have these risk factors, definitely that can lead to urinary tract infection. Now, the main thing is nursing diagnosis, right? So now we will see the nursing diagnosis. There are a list of nursing diagnoses, and here you can see the nursing diagnosis based on priority. The first one is acute pain. Acute pain related to inflammation of the bladder and urethra, secondary to urinary tract infection, as evidenced by patient verbalizing burning sensation during urination and suprapubic discomfort. Second one, risk for deficit fluid volume related to fever, increased urinary output, and decreased oral intake. Third one, knowledge deficit related to causes, prevention, and management of urinary tract infection as evidenced by patient asking questions and lack of any prior education. Next one, impaired urinary elimination related to inflammation and irritation of the bladder and as evidenced by urinary urgency, dysuria, and reports of incomplete bladder emptying. Next one is hypothermia, that is related to infectious process as evidenced by elevated temperatures and chills. Next one, risk for sepsis related to ascending UTI and possible progression to systemic infection. So these are all the major nursing diagnoses you can write for urinary tract infection. Now we will see the nursing care plan. And as I said always, while writing your nursing care plan, please write it in columns. Okay. In the first column, always assessment. In assessment column, again, you have to add the subjective data and objective data. Then in diagnosis column, you have to write the actual diagnosis plus goal, then planning, Then rational. In rational, always start with to, and implementation always in past tense, and evaluation also. That is depend upon your goal. So first we will see assessment for acute pain. Assessment. What is subjective data? What patient says about the condition? The patient complains that they got pain while passing urine. And the objective data is the patient looks very dull and tired. Okay. So this is the subjective data and objective data. That means what patient says about the condition and what you have observed as a nurse. In second column, you have to write the nursing diagnosis like acute pain related to inflammation of the bladder as evidenced by patient verbalizing burning sensation during urination. Then what is the goal? The patient will report decreased pain level because the diagnosis is pain. So the patient will report decreased pain levels within 48 hours of initiating the treatment. Okay. And here you can see in future tense. This is in future tense always. The patient will report. After that, you can write the planning. And planning will be in present tense because that is a plan. Okay. Assess pain level regularly using a standardized pain scale. And what is the purpose of doing that plan? To monitor effectiveness of the pain management. And in implementation column, you can write assessed, monitored, encouraged, administered. Alright. So here assess pain level means definitely you can write assessed or monitored the pain level and adjusted the interventions as needed. Second one, encourage increased fluid intake to prevent the urinary tract infection or to dilute the urine. In implementation column, encourage the fluid intake and reduce irritation. Next one, administer medication like analgesics or antibiotics depend upon the order or as ordered. For what? To relieve the discomfort and target the underlying infection. In implementation, you can write administered medication as per the doctor's order. Next planning is encourage the patient to avoid frequently and completely. For what? To reduce the risk of bacterial growth. In implementation, you can write encourages or encourage to go to toilet and reminded. Then last planning here is apply warm compress to suprapubic area if needed. For what? To relieve bladder pain and spasms. And implementation again, if it is applied, definitely applied warm compressor. And in evaluation column, always it's depend upon goal. The patient will report decreased pain. So in evaluation column, the patient reports pain scores decreases. Okay. 2 or decrease 2 by 10. So out of 10 now 2 is the pain. Okay. And no burning sensation during urination and improved comfort level. So this is the nursing care plan for acute pain. Now we will see the second one. Risk for fluid volume deficit related to fever. The subjective data is the patient says that he or she feel very tired and weak. Objective data, that means what you have observed. The patient's temperature was very high and the vital signs was not stable. And the goal is the patient will maintain adequate hydration as evidenced by normal urine output and will maintain moist mucus and stable vital signs. That's your goal. For that, you can see the planning here. Monitor intake and output every shift. For what? To ensure adequate hydration. In implementation, monitored and tracked fluid balance and output. Second one, encourage oral fluid intake minimum 2 to 3 liters if it is not contraindicated. For what? To support hydration. In implementation, encouraged oral fluid and started to take 2 to 3 liters and there is no side effect or contraindications. Next one, monitor urine color, clarity and odor. For what? To improve the situation or to check the situation. Implementation, monitor the urine color and odor and recorded. Then planning, assess for signs of dehydration. For what? To prompt intervention, to enhance the intervention. And implementation, assessed and recorded and informed the doctor. Okay. And in evaluation column, based on the goal, the patient maintained adequate urine output, demonstrates moist mucous membrane and shows no signs of dehydration. So in that way you have to compare your goal and evaluation always. Next one, for knowledge deficit. So the patient doesn't have any awareness about the specific condition. So you have to health educate the patient, right? You have to educate the patient. So the planning will be based on that. The subjective data, the patient said that he or she unaware about the causes and risk of condition. So they said, I don't know anything about this condition. Like that also you can write. In that subjective way, the patient says that I don't know anything about this condition and causes. In objective data, you can write the patient was very tensed and anxious while undergoing this situation. All right. Then goal, the patient will verbalize understanding of UTI, prevention, management before discharge. So in goal, what is your goal? The patient should say, okay, this is UTI, this is the cause, this is the risk factor, right? Then while coming to the planning, always start with education. Educate the patient on the importance of completing the full course of antibiotic. You should educate what's the need of taking antibiotic. Rationale to develop resistance and recurrence. Implementation educated the patient. All right. Second one, teach proper perineal hygiene. That's very, very important. There are different techniques like wiping from front to back. So you should teach that specific technique to the patient. Forward to prevent the bacterial infection in the urethra. In implementation, you can write taught about personal hygiene, perineal cleaning from wiping from front to back. Then encourage urination after sexual activity. And what is the rationale? It helps them to eliminate bacterial infection during intercourse. Then in next one, in the implementation, you can write advised or encourage the urination, advise and exploit the need of doing this process. Like that you can write. Then discuss avoidance of irritants to help them to know how it can irritate the bladder. Discussed about caffeine, alcohol, tight underwear, perfumes, etc. So it can give irritation and that irritation may leads to UTI. And in evaluation column, you can write the patient correctly states the importance of medication, adherence, and prevention strategies. Or the patient verbalized the understanding. The patient understood. In any way you can write. Okay. So this is about knowledge deficit. All right. Next, we will see impaired urinary elimination. So, subjective data is the patient complains about difficulty in urination and incomplete voiding. Okay, so that is the next one. So, here urinary elimination is impaired. So, the patient always complains about difficulty in urination in that case. Objective data is what? The patient's urinary pattern was not proper. You can check the records and notes and you can write the objective data. Then you have to write the diagnosis, then you have to write the goal. The patient will demonstrate a pattern of normal urinary elimination within 3 days. And again in planning, based on that you have to write the plans, monitor urinary pattern for what? To provide say data about urinary tract, urinary functioning and infection and progression, monitored and record in implementation. Then encourage voiding every 2 to 4 hours because there is impaired urinary elimination for what? To prevent urine stasis and support bladder function. And in implementation, you can write encouraged and recorded. Then next planning is palpate bladder for distension after voiding. For what? To ensure complete emptying of the bladder as well as to prevent infection. Then in implementation, you can write palpated and help the person to do the procedure. Then administer antispasmodic or analgesics as prescribed, or simply you can write administer the medications. For what? To reduce the risk of infection or to reduce the bladder spasm. Implementation administered the medication, antispasmodics or analgesics as prescribed. Alright? And again, in evaluation based on your goal, the patient demonstrated a good pattern of urinary elimination. The patient demonstrated a good pattern of urinary elimination, or you can write the patient reports relief from urinary symptoms, voids without discomfort, and maintains regular elimination pattern. Alright? This is the nursing diagnosis and claim care plan for you impaired urinary elimination. All right, impaired urinary elimination. The next one is hypothermia. For hypothermia, what subjective data we can write? What patients will say? The patient complains about high body temperature and fatigue. Obviously, it is hypothermia. So, always the patient will tell that I am feeling very tired of. So, then objective data, the patient looks very dull and slows high fever. And when it comes to objective data, the patient looks very dull and shows high fever. And you have to write the nursing diagnosis again, hypothermia related to infectious process as evidenced by elevated temperature. Then the goal, the patient will maintain body temperature, I mean normal body temperature within the normal range. And when it comes to planning, you have to plan based on this nursing diagnosis. So monitor temperature every 4 hours. Forward to tracks infection response and effectiveness of intervention. And in implementation column, monitor the temperature. Next planning, administer antipyretics because high fever as prescribed by the doctor. Forward to lowers fever and provides comfort. Implementation administered as per the prescription. Next planning, encourage fluid intake. Forward to regulate the body temperature. Implementation, encourage 2 liter and no contraindication. If it is there, definitely have to write that. Then use cooling measures like cool compress, light clothing, fan, etc. For what? To reduce body temperature naturally. And in implementation, you can write used cooling measures like fan and clothing. And in evaluation column, based on your goal, you can write the patient's temperature returns to normal and chills and discomfort subsided. So this is about hyperthermia. So for hyperthermia, you can write this nursing diagnosis. Next one, risk for sepsis. Risk for sepsis related to ascending UTI and possible progression to systemic infection. That means spreading UTI. Subjective data, obviously the patients will say some discomforted and feeling very tired because chances of infection. Objective data, the patient looks restlessness, BP was very low and high fever. Whatever you observe that you can write there. And in the goal, what's your goal? The patient will remain free from signs of systemic infection and patient should be safe during the hospitalization. And in planning, based on this one, you have to write the planning. Monitor vital signs, monitored to detect clear signs of systemic infection. Monitor for signs of worsening infection. Monitored in implementation and in rational for what? To recognize the early indicators of sepsis. And in again planning, obviously medication is important. So you have to write administered antibiotics administered for what? To prevent the progression. And obviously you have to educate your patient because that's very important to prevent or worsening the condition. And you can write in implementation educated and the rationale is to prevent the complication. And in evaluation column, based on your goal, you can write the patient remains febrile with stable vital signs and no signs of systemic infection. All right, so these are all the nursing diagnosis and care plan for UTI. Hope you understand, guys. We'll come back with other nursing diagnosis.